Do you know the signs of breast cancer? Hi, I'm Sherry from Twin Sisters Mastectomy Boutique, and I work with a company called True Life that manufactures a bunch of medical stuff, including breast prosthesis and mastectomy bras. And the mastectomy bras that they create are actually sewn and created here in Ontario, Canada, in a little place called Trenton. It's kind of near Ottawa, which is our capital of Canada. But they sent out this little door knocker thing, hang it on your door, that gives you the signs and symptoms of breast cancer. And I'm just going to read it out to you because I think it's really helpful. So number one is constant pain in one part of your breast or armpit. Now, yes, pain, but I will say that most of the people I've spoken to have no pain, no discomfort, nothing. There are no signs. But if you do have pain or discomfort, go get it checked out. A change in the skin, like puckering, dimpling, like an orange peel, or redness. And that is very important. Now, you may not see anything at all, but from your collarbone to your rib, under your arm, any change in the texture of your skin, right? Dimpling or just redness, anything like that, go get it checked out. Don't wait. There's no need to wait. Go get it checked out. A change in the nipple shape or direction, like a pulled in or flattened nipple. So, inverted nipple where it's in, if it changes shape, if it flattens out, if it just looks different than it did before, go get that checked out. It could be a sign of breast cancer. Also, any discharge from the nipple, that's important too. A lump, any size, or thickening in your breast. So when we say a lump, it could be tiny little granules, almost like sand. It could be something bigger that we go, oh, that feels like a lump. This is why it's important to do your breast examinations every month. In the shower, your hand is soapy, you can just slide it over. And then you get to know what your breasts are like, because some people have lumpy breasts naturally, some people don't. Some people get lumpy breasts around their menstrual cycle. So it's good to know, but even if you have lumpy breasts and something's different, go get it checked out. And you can't just put your hand over, you need to press in and, really feel for anything. Because, the sooner breast cancer is found, the, faster it gets taken care of and you can start treatment. And we all know awareness saves lives. Change in the size or shape of one breast. Okay, so usually, I'm not a doctor or a nurse, but usually breast cancer affects one side and not both sides at the same time. Now, you can get breast cancer in both breasts. I've seen it a ton of times, but it's usually not simultaneously, meaning it's usually not at the exact same time. Having said that, I will say that I've had ladies who have had breast cancer in one breast and they're like, I want both of them off, and they have found breast cancer in the other breast. But if there is a change in the size or the shape of one breast over the other, or even both of them, something's changing. They don't look the same. They are looking different. The shape has changed. There's the skin is thicker. Something's different. Go get it checked out. Any unusual discharge. Now, we talked about this. Any unusual discharge or like liquid from one or both of your nipples, and it could be clear, it could be milky, it could be bloody, anything, any sort of discharge, because that's not normal. A change around the nipple, such as a rash or flaky or crusted skin. Okay, again, we're going with the texture. When we think of breast cancer, we think of a lump only, right? Oh, we're looking for lumps. But a change in the skin, it's red, it's rashy, it's super dry, it's scaly, it's flaky, change in shape, anything like that could be a sign of breast cancer. Swelling in the area of your collarbone, which is right here, or your armpit. And most people think, breast cancer, breast, just right here. But all of this is your breast tissue. from your collarbone up here to your second rib, under your arm, all of this is breast tissue. So if you're getting swelling or redness or rash, change in skin, swelling under your arm, right under your arm, that's all breast tissue as well. Your collarbone, go get that checked out. And any change in how your breast normally looks and feels, right? Any changes. It doesn't matter if we didn't list it here, okay? Because there's going to be other things. But you're looking at your breast in the mirror and you're like, something's different. Something's not the same. What is that? It might hurt, it might be tender, it might not be. Might be perfectly fine. Everything feels great. You might not feel any lumps. You might just see like, oh, my skin looks different, or my nipple looks different, or have things changed, or oh, my collarbone, that's kind of swollen. You might not even think that has anything to do with your breasts. Trust me when I tell you, anything in this area that has any change, go to your doctor. Best case scenario, they go, oh, you're wasting our time, nothing to worry about. Now, if they say that and you're still worried, go get a second opinion. Okay? You know your body better than anybody else. But best case scenario, it's nothing. But isn't it worth checking out? Aren't you worth checking out? Your family, your friends, your loved ones, your pets, all depend on you. They all love you. And you need to get checked out. If you've had breast cancer, or if you're a healthcare professional and there's something I've missed, like what did you find on your body that was different and it turned out to be a sign of breast cancer? Or as a healthcare professional, what have I missed that we should be looking for? Don't forget your annual mammograms, and at the first of every month, do your breast self-examination. Why wouldn't you? Don't forget to like and subscribe. We'll see you soon.